All right, hello, I'm Diana. I'm the MP student going to be doing your physical exam today. Could you please tell me your name and date of birth?
Sure, it's Abdominal, October 31st, 2003.
Can you tell me where you are right now?
In the office.
Great, so patient is A0 times 3. Patient appears to be well kept, well nourished, and is conversing appropriately. Okay, so inspecting the head. Head is normal, cephalic, and atraumatic. Inspecting the scalp. Scalp is clean, no flaking, no lesions, no redness. Hair distribution is equal with no, and hair is smooth and fine in texture. Okay, palm palpation. There's no bumps, no masses. Any tenderness?
No.
Okay. Inspecting the face. Face is symmetrical, no discoloration, no lesions, no redness, no hirsutism. I'm going to be palpating your temporal artery. Any tenderness?
No.
Okay, temporal pulse is 2 plus bilaterally. Okay, now moving on to your eyes. Do you wear glasses?
No.
Okay, cover your right eye for me and read the bottom line.
LTFPH.
Cover the other eye and read the same line backwards.
HPFTL.
Okay, so patient's visual acuity is 20/20 bilaterally uncorrected. Optic nerve 2 is intact. Okay, so now I'm going to be inspecting the external structures of your eyes. So eyes are aligned and symmetrical. The eyebrows and eyelashes are full and symmetrical. The medial and lateral canthus are intact with no signs of swelling or discharge. The lacrimal system is intact with no signs of swelling or discharge. And the corneas are free of any opacities. And I'm going to be checking, pulling down your eyelid. Great. So the sclera is white bilaterally, no jaundice or redness. Conjunctiva is pink and moist. The iris is brown and evenly colored, and pupils are equal and round. Okay, so now I'm going to be checking your light reflex. Okay, so corneas are symmetrical. I'm now going to be checking for direct and consensual response, so checking directly your left eye. Now checking consensually, looking at your right eye. Great. Okay, checking your right directly. Great, so pupillary response is intact. And now shining in your right and checking the left. Great. So pupils are equal, round, and reactive to light directly and consensually. I'm now going to be checking for convergence, so follow my fingers. Okay, so eyes converge symmetrically. Now I'm going to be checking for accommodation, so look at the image on the wall. Now look at me. Great. So pupils dilate at a far object and constrict at a nearby object, so accommodation is intact. I'm now going to be checking for extraocular eye movement, so follow my finger with just your eyes. So extraocular eye movements are intact, cranial nerves 3, 4, and 6 are intact, and there's no nystagmus noted. I'm not going to be checking for peripheral vision using the confrontation test, so cover your right eye for me. Okay, and look at my nose. Do you see my hands?
No.
Okay, so let me know when you see them.
I see them. I see them. I see them.
Okay, cover your other eye. Keep looking at my nose. Ready? Do you see my hands?
No.
Let me know when you see them.
I see them. I see them. I see them.
Okay, so peripheral vision is intact. I'm now going to be doing a fundoscopic exam to check the inside of your eyes. Okay, so checking your right eye with my right eye. The red-orange reflex is intact. The lens is free of any opacities. Retinal vessels are intact with no signs of AV nicking. Optic disc is intact and sharp. Cup to disc ratio less than 0.3. Mean is 0.3. And the macula is intact with no lesions. Checking your left eye with my left eye, the red-orange reflex is intact. The lens are free of any opacities. The retinal vessels are intact with no signs of AV nicking. Cup to disc ratio is 0.3. The optic disc is visualized and sharp, and the macula is intact with no lesions. Okay. All right, so moving on to your nose, I'm going to be checking for patency. So take a breath. Take a breath. Nostrils are patent. Can you cover your eyes for me and tell me what you smell?
Strawberries.
Okay. Tell me what you smell.
Cinnamon.
Great. So olfactory nerve 1 is intact. I'm now going to be inspecting the nose. Nose is symmetrical, no discoloration, no lesions, no swelling. Palpating, any tenderness?
No.
Okay. Palpating maxillary sinus, any tenderness?
No.
Frontal sinus, any tenderness?
No.
Okay. I'm now going to be inspecting the inside of your nose. Okay. All right. So inspecting the right nostril. Nasal mucosa is pink and moist. There is no swelling, no discharge, no lesions. There's no deviation of the septum and no nasal polyps and no perforation. Okay, checking the left nostril. Nasal mucosa is pink and moist. There's no swelling, no discharge, no lesions. There's no bleeding. There's no septal deviation, and there's no polyps or perforation. Okay. Now moving on to the mouth. Mouth is pink, lips are pink and moist. There's no swelling, no discharge, no lesions. Can you open your mouth for me? Can I see your teeth? Can I see your teeth? Teeth are all intact and white. Can I see your gums? No, you just close your mouth. Gums. Great. So gums are pink and moist. There is no inflammation or bleeding. Open your mouth for me. Okay, I'm going to be checking your buccal mucosa. So buccal mucosa is pink and moist bilaterally, no signs of swelling or discharge or lesions. Can you stick out your tongue for me? Okay, so tongue is midline, pink and moist, no signs of swelling or lesions. Lift up your tongue for me. Okay, so ventral tongue is pink and moist, no signs of swelling or lesions. Okay, can you stick out your tongue and say ah? Okay, so uvula is midline, tonsils are visible and intact, pink and moist, 1+, no signs of swelling, redness, or exudate. Look up for me. Your hard palate is pink and moist, no signs of swelling or lesions. Great. Okay, moving on to the ears. I'm now going to be doing a hearing test on you, so I'm going to stand behind you. Look, and cover your left ear. Tell me what you hear. 1, 2, 3. 1, 2, 3. Okay. Cover your other ear. 1, 2, 3. Great. So, Gore's hearing is intact bilaterally. I'm now going to be performing the Weber and Bryan test to check for any hearing loss. So, tell me when the vibration stops. I'm placing it on your mastoid process.
Okay, stop. Okay. Stop.
Okay. Tell me when it stops.
And stop. And stop.
Great. So, air conduction is greater than bone conduction. I'm now going to be performing the Weber test. So, let me know if you hear the vibration louder in one ear or the same. Great, so there's no lateralization, no sensorineural hearing loss. Okay, so now I'm going to be inspecting the ears. So auricles are midline, symmetrical, there's no redness, no lesions, no swelling, no nodules. I'm going to be palpating your tragus, any tenderness?
No.
Mastoid process, any tenderness?
No.
And your pinna, I'm pulling back, any tenderness?
No.
Great. So now I'm going to be checking the inside of your ear. Okay, so I'm checking the right ear, I'm pulling it up and back. So checking the inside, so there is minimal cerumen, ear canal is clear, no signs of inflammation, redness, discharge, or swelling. Tympanic membrane is visualized pearly gray, no bulging, no perforation, no scarring. Cone of light is at 4 o'clock, and the pars flaccida and malleus are visible. Okay, checking. Yeah. So checking the left ear now, pulling it up and back. Alright, so ear canal is clear, minimal cerumen, no swelling, discharge, or lesions. Tympanic membrane is visible, pearly gray, no bulging, perforation, or scarring. Cone of light is at 8 o'clock, and the malleus and pars flaccida are visible. Okay, moving on to the neck. So the neck appears to be symmetrical, no discoloration, no visible pulsations. I'm going to be palpating your lymph nodes. Let me know if you feel any tenderness. Preauricular, postauricular, occipital, tonsillar, submandibular, submental, superficial cervical, deep cervical, posterior cervical, and supraclavicular. Any tenderness?
No.
Great. I'm now going to be checking for any tracheal deviation. Okay, so trachea is midline, it's not deviated. I'm now going to stand behind you and check for your thyroid. Just swallow for me. Great, so thyroid, there's no goiter. It feels symmetrical, no nodules, no enlargement. Do you feel any tenderness?
No.
Great. Alright, so now moving on to the chest. Inspecting the anterior chest. Chest is symmetrical. There is no lesions, no rashes, no bulging of the chest, no retractions. Alright, AP to lateral diameter is 1 to 2, no bilateral, no barrel chest. Rate and rhythm of the respirations is regular. I'm now going to be palpating. Any tenderness?
No.
No. Okay, I'm going to be percussing. Okay, so resonance heard at all fields. I'm now going to be auscultating. Take a breath from me whenever you feel my sense. Okay, great. So no adventitious breath sounds noted. I'm now going to be moving on to your posterior chest. So could you please, turn this way for me? Thank you. So inspecting the posterior chest. Posterior chest is symmetrical. There is no redness, no swelling, no lesions. Okay, I'm not going to be palpating any tenderness.
No.
Okay, no bumps, no masses. Checking chest expansion. Okay, do you feel, can you take a deep breath for me? Great. So chest expansion is symmetrical. I'm not going to be checking for tactile firmness. So whenever you feel my hand, say 99, okay?
99, 99, 99, 99.
Great. So vibration was heard at all fields. I'm now going to be percussing. Okay, resonance heard at all fields. I'm not going to be performing diaphragmatic excursion, so please take a deep breath and hold it. Great, so dullness noted. Now exhale and hold it. Great, so dullness noted. So diaphragmatic excursion is 4 centimeters, which is normal. I'm now going to be auscultating the posterior chest. Take a breath whenever you feel my stethoscope. Great, so now adventitious breath sounds noted. I'm now going to be checking for consolidation, so whenever you feel my stethoscope, just say E. I'm going to be performing echophony, okay?
E, 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 E.
Great, so I heard E and not A, so there's no consolidation. I'm now going to be performing whispered ventriloquy, so whenever you feel my stethoscope, whisper 1, 2, 3. Great, so the 1, 2, 3 was muffled, so there's no signs of consolidation. This concludes our exam. Thank you so much for your time today.
Okay, ready? Okay. Hello, I'm Mia, and I'll be your nurse for today.
Okay.
I just need your name and date of birth real quick.
Yep, my name is Mary Cole, and my birthday is 10/30/70.
Perfect. Okay, what brings you in here today?
So, over the past few days, I've been having diarrhea with blood in it, and I've also been having a lot of stomach pain, and I've been noticing like extra bloating lately.
Yeah. So where is this pain exactly that you've been feeling?
It's like in my lower stomach area.
Okay.
Yeah.
When did it start?
I think it started about 4 days ago.
Okay, how long has it lasted?
It's been lasting this whole time, and it's like progressively gotten worse, I'd say.
Okay. How severe would you say it is if you would rate it from 0 to 10, 10 being the worst?
I'd say when like the pain, when like the cramping is the worst, it'd probably be like a 5 out of 10.
Okay. And then is there anything that makes this worse or makes it feel any better?
Right before I have to go to the bathroom, it's probably when it's the worst. But then after I use the bathroom, I get a lot of relief and the pain goes down.
Okay. Is there anything that is associated with this, or that has this happened before?
I feel like it might have something to do with my ulcerative colitis that I have, but I've had it for almost 30 years now, and I think this is probably the worst flare-up that I've ever had.
Okay, good to know. Okay, since this is in your GI tract, I'm just gonna kind of ask you some questions about your mouth, throat, and just everything, abdomen. Okay, so I'm gonna start with your mouth. Have you had any sores or lesions in it?
Nope, nothing like that.
Any bloody gums or any dental abnormalities?
Nope.
Okay, what's your dental routine? Brushing, flossing?
I brush twice a day, and I try to floss a couple times a week.
Okay. Have you noticed any sore throat or voice changes?
No, nothing in my throat.
Okay. Any difficulty swallowing?
Nope. I think swallowing's been pretty good.
Okay. And then no difference in food you've eaten or taste?
No, my taste is good, and eating all the same foods.
Okay. Do you smoke or consume any alcohol?
I don't smoke. I probably drink alcohol like once or twice a week.
Okay. So, do you do any self-care behaviors just daily or weekly, or anything just for yourself, exercise-wise, meditation, anything like that?
I do exercise. I try to go on a walk like once a day, and then I also try to get in yoga like twice a week.
Okay. So have you noticed any appetite changes? I know you said you haven't been eating anything different, but you felt different?
No, I haven't noticed any appetite changes really. I'm thinking everything the same.
Okay. What about food intolerances? Like anything sparking or triggering anything?
I noticed when I first got ulcerative colitis that dairy did not sit well with me.
Okay.
So I try to avoid that while eating.
Okay. So I know you have cramping, but is there any nausea or vomiting from anything?
No nausea or vomiting. It's more going to the bathroom.
Okay. And this is especially important for your ulcerative colitis, but could you talk about your bowel movements or habits?
Oh yeah. So usually I probably have a bowel movement like once a day, I think, but lately it's been happening like 4 to 5 times a day.
Okay. And so you have ulcerative colitis. Is there anything else in your medical history?
I recently
The
was.
importance with just mainly abdominal issues or anything in your
No, I think just the ulcerative colitis. Is
Okay.
The only GI thing I've had.
Okay. And any medications, they don't have to, that pertain to ulcerative colitis or just any in general?
The only medication I'm on right now is called Lialda, and it's just something I take once a day it's like a maintenance medication for my ulcerative colitis.
How long have you taken that?
Since my diagnosis, so for 20-something years.
Okay. And for just nutrition in general, could you just talk a little about your diet or just what you've eaten in the past, 24 hours?
Yeah, so I'd say for breakfast I usually eat like a bagel or a muffin and then like a cup or 2 of coffee. And then for lunch I typically eat like a salad usually. And then for dinner I like to have protein, so salmon or chicken with like potatoes or another vegetable. And then I'm trying to get better on my water consumption, but I don't drink as much as I probably should.
Okay, yeah, definitely something at least you know to work on it.
Yeah.
So for now, I'm just gonna take your vital signs. So now I take her vital signs, and I do blood pressure, pulse, temperature, and oxygen saturation, and yes. Okay, sorry. So now I did your vital signs. Okay, so now I'm just going to do your, and respiratory rate, which I get to later. Sorry, that's why I left it out. So now I'm going to go back and I'm just going to do an assessment from your head to toe and ask you questions, move you around a little bit. So first I'm going to start, I'm just going to ask you some questions. Do you know who you are? Can you say who you are, why you're in here, where you are, and just tell me the year it is?
Yeah, so I'm Mary Cole. I'm in here because of my ulcerative colitis flare-up is what I'm assuming it is. I'm at Bethesda North Hospital and it's 2020.
Perfect. Okay, and now I would know her cognition at this point and know that she has normal cognition and her speech is fluent, and then I take note of her mood, saying she's polite, pleasant, and cooperative. Okay, now I'm going to test your eyes a little bit, and I'll come up over to you. Okay, can you just listen to me? Okay, so now I'll just have you look into the light, or actually look straight ahead for me. Oh, I'm so sorry. Wrong way. Okay. Okay, great. Sorry, didn't mean to blind you there. So now just follow the light without moving your head. Okay, perfect. You look great. Now I'm just gonna look at your face, check for symmetry. Can you smile? Can you raise your eyebrows a little bit? Perfect. Okay, great. So now I'm going to look, wait a minute, my pen again, and check. Can you open your mouth a little bit? Check the inside. Okay, nice and pink in there. Great. Okay, so now I'm going to check out your skin.
Okay.
I'm just gonna see for color and for temperature and moisture. Okay, now I'm gonna check out your nails. Thank you. And look at the color of them. Your nails are looking a little pale. Usually they should be a little more pinker. Would you have any history with anemia or any other thing like that?
Yeah, I actually was recently diagnosed with anemia,
Okay.
but I feel like I've been feeling like looking a little paler more recently.
Okay, that could have to do, even with your ulcerative colitis, if you're losing more blood than usual. That
Yeah.
makes a lot of sense. Okay, now I'm gonna test out your capillary refill on this hand, and it's a little bit longer than 2 seconds, just what it's supposed to be, but that could be just be a minute or two.
Okay.
And then I'm also going to check your skin now. On this hand, temperature, and get the color, and for moisture. And then I'm going to check your toes out for the same thing. You see me so? So checking for color of your nails, and then the capillary refill. Good. Sorry, I don't mean to. Okay, that is great. Sorry. Okay, skin. Now I'm going to use my stethoscope and do some sounds on you. If you could sit up for me, that'd be great. Okay, so I'm just gonna do. I just have to hear this. I'm going to do your heart sounds first, and I'm going to start with your neck, and then I might have to ask you to move your clothes down or up if that's okay.
Yeah, that's
I'll
fine.
just tell you what to do as we go.
Okay.
So, first I'm starting with carotid artery sounds
Okay.
on both sides.
Ooh, it's a little cold.
Yeah, sorry about that. Okay. Okay, and then now I'm going to go chest sounds again for your heart. Start with your aortic valve on your right side, second intercostal space. I'm gonna have to move this a little bit.
It's fine.
Okay, now to your pulmonic sounds, the second intercostal space. And then, can you move it down a little bit?
Yeah.
Thank you. Third intercostal space for your herbs point. And now, tricuspid valve sound. Okay, perfect. Could you lift it up for the last sound? I just need to do it right here. Perfect. And this will be at your fifth intercostal space on the apex of your heart. Okay, and then I forget if I mentioned that your herbs point was the third intercostal space, and then tricuspid was your fourth.
Okay. Perfect.
So just a little extra information there.
Can I go back to laying?
Yes. Well, actually, I'm gonna do your lung sounds now.
Oh,
So
okay.
you might want to sit up still for that.
Okay.
Okay, but yes. Okay. So I'm just going to do front, back, and then I'm gonna have to do both of your sides.
Okay.
Okay.
That's good.
Perfect. Okay, checking for lung sounds. Take a big deep breath in and out, and then just do that every time I place the stethoscope into a new area.
Okay.
Okay. Now, can you? Oh, actually, I'll come over over here, and yes, oh, perfect right there. Oh wait, you might want to move. Okay, that's good. Breathe in and out. Big deep breath. Same thing on the other side. Okay, now I'm going to do this side of you.
Okay.
Okay, I'm just going to have you lift this up a little bit. One more time. Okay, perfect. Great. Now other side, real quick. Come over to you.
Okay.
Okay. Great. Sorry, that was a lot.
It's okay.
Okay. Now you can lay back down, and I'm going to inspect your abdomen.
Okay.
See what's going on in there. Okay. So I'm going to inspect it and see color, if there's any masses, but they look good. No tattoos, scars, looking good. And so now I'll auscultate it, and I'm gonna go 4 different sections a little bit.
Okay.
And listen to your bowel sounds.
Okay.
Okay. Oh, sorry. Throw that. Okay. They seem pretty hyperactive in there. Some high-pitched gurgling. And you got a lot of bowel movements going on, but that makes sense for what's going on with you. So now I'm just going to palpate it gently and let me know if it's tender at all, because I know you've had a lot of cramping going on.
Okay. That feels okay.
Okay, you good?
Mhm.
Okay, feels good. No masses or anything, which is great. Okay, now for your pulses, if you could sit up a little bit, that'd be great. Okay, let me check. Yes, your pulse right here.
With my wristband.
Oh, you're good. Okay. See this at the same time I do it. Okay. Pulse is great within normal limits. Now I'm going to take your pulse on your feet, on the top part.
Okay.
Okay. Feeling on the dorsalis pedis. Okay, now I'm going to do it inside of your ankle, right below this medial malleolus. On the inside of our ankle, if you can't see. Okay? And same thing. Well, I'll just, for video purposes. Okay. Strong right here. looks great. So now we've done the pulses, and now I'm just gonna check you. You said you had some swelling.
Yeah.
So first, I'm just gonna check any other areas of swelling in your legs, and now just look up your abdomen and it's pitting. Okay, yeah, you have some non-pitting edema, I think, in your stomach, which would explain the bloating feeling.
Okay.
And then lift your arms real quick. For any. Okay, now this side. Okay.
So it's edema, swelling.
Yes.
That is okay. Gotcha.
But yes, definitely happened. It's all ulcerative colitis.
Okay.
A lot going on.
That makes sense.
Yes. Okay. So edema is checked. So do you have any questions about that or anything?
No, I think that's it. I never knew that edema and swelling were the same thing.
Great. Now I'm gonna move you around at all and see your range of motion. But if anything hurts, let me know. Oh gosh, 13, 19. Okay. So now I'm just going to move this, and can you move in a circle for me?
Yeah.
If anything's different. Okay. The other side. Okay. Now your legs. Okay. So now I'm going to let me put resistance on it, and you have to move it down.
Okay.
Great. Okay, this side. Okay, now I'm going to put the resistance on it.
Okay.
Okay, now test your strength. So range of motion is great, and your strength is great too.
Okay.
And I'm just going to do that with your arms now. With resist, can you move it forward and down? Great. Okay, down against resistance. Okay, great. Okay, hi. Her phone just ran out of storage, so we're switching phones really quickly. So I hope it isn't a problem, but we think it got most of it. I really just had to do gait left, which I'm about to do right now. So Miracle, if you could get up and walk towards me to see your balance, that would be great. And I'll move back here, and you can walk here and then back.
Okay.
Great. Okay, perfect. And I believe that sums up our assessment. If you would have any questions, let me know.
Okay.
Are you good?
Yep. Thank
Okay.
you.
No problem.